Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. We don't know enough about the health risks of vaping. Since vapor products are so new, we lack long-term studies measuring health impacts over time. Therefore, to be cautious, we must restrict vaping and possibly ban flavors. If these measures deprive smokers from a safer alternative to smoking, well, it's worth it to protect the kids. These arguments are promulgated ad nauseum by regulators and public health authorities in the ongoing smear campaign against vaping. The Food and Drug Administration, U.S. Public Health Service, Office of the Surgeon General, and Centers for Disease Control and Prevention continue to stoke fear and raise doubt regarding the health impacts of vaping. While it's true the vaping industry staved off disaster this summer when the Food and Drug Administration took a dramatic U-turn on compliance deadlines, FDA's support for vaping as a viable method to quit smoking remains in doubt. In December, the FDA launched its Every Try Counts campaign, a new 2-year public education initiative to encourage adult smokers to try to quit. Glaringly absent in campaign materials, however, is any mention of vaping as a viable tool to help quit smoking. The quit methods that are promoted include the archaic resist cravings by distraction method, get nagged by text message or app method, and of course the trusted counseling and drug method. According to the U.S. federal government, pharmaceutical options offer the best chance of quitting. While one federal initiative turns a deaf ear to vaping, another continues the public fear-mongering with this recycled PSA running on cable news networks in the month of December.
Some say e-cigarettes aren't dangerous.
But science shows nicotine can harm teens' developing brains.
No matter how they're exposed.
Let's do an experiment to find out.
Here's a teen who won't be using e-cigarettes.
Now we need one willing to risk their brain development.
Anyone care to volunteer your kid?
Your kids are not an experiment. Protect them from e-cigarettes.
Public health attacks on vaping, as demonstrated in this PSA, typically contain weak arguments, cherry-picked data, sneaky rhetorical moves, and unfair representations. Public health propagandists swoon over science, yet respond purposefully obtuse when presented with scientific evidence supporting vaping as a safer alternative to smoking. Progressives stubbornly insist the science on vaping isn't settled, yet a growing number of expert researchers say that when it comes to the health benefits of vaping, the case is closed. One of those scientists is Dr. Riccardo Poloza, director of the Institute for Internal and Emergency Medicine at the University of Catania in Italy. He's the author of more than 280 peer-reviewed articles, many of which present results from his groundbreaking research on e-cigarettes. Dr. Poloza is an expert in lung disease, and over numerous studies, his research provides clinical evidence supporting the health benefits of vaping, not only to reduce harm, but in some cases even reverse the harm caused by smoking. Dr. Poloza was the lead scientist on the first clinical trial to conclude e-cigarettes are an effective tool for smoking cessation, and his latest study is the first ever to monitor vaping risk factors and health outcomes over an extended period of time. Published November 2017 in the journal Nature, the study is the exact type of longitudinal observational research vaping critics have been calling for. Dr. Poloza and his team followed 9 adult e-cigarette users that vape daily and who have never smoked over a period of 3.5 years. The team measured and tracked blood pressure, heart rate, and body weight, lung function, lung inflammation, and respiratory symptoms. Nitric oxide and carbon monoxide levels in exhaled breath were measured, and high-resolution computer scans of the lungs were reviewed. After comparing results with a carefully matched control group, the study found no significant changes in any of the health outcomes investigated. Now joining us today from his office at the University of Catania in Italy is Dr. Poloza. Thanks for joining us today on RegWatch. First off, what was the inspiration behind this long-term study?
It was inspired by vapers. There were many vapers asking whether they were risking their health by switching to these products. Of course, at the time there was very little we could say besides the fact that these products were not combusting tobacco, and by not combusting tobacco were immensely less harmful. However, there was no direct evidence of this less harmfulness, okay?
Dr. Pelosa, let me ask you directly, are smokers risking their health by switching to vaping?
If a smoker switch to these products, is not risking his health, it's actually improving his health. Case closed. I mean, I think there's nobody else in the world with the experience I have, with many clinical experience I have with vapors in the clinics, in the smoking cessation centers, and never been seeing anything going wrong with them.
Dr. Pelosa, how were the participants recruited back in 2012 for this 4-year study?
We had a network of vape shops collaborating with our institution, and by asking the vape shop salesperson to identify vapers who never smoked in their life, we helped them prepare a very simple questionnaires with the definition of never smokers. The classical definition is no more than 100 cigarettes in a lifetime, and defining the characteristic of daily usage for at least 3 months.
Dr. Pelosa, why was the study modeled on never smokers who vape daily?
Zero smoking history is important. Why is that important? Simple. Because any switching study, if you want to measure risk reduction or harm reduction in switching study, we will need always to compromise with the background damage that is being already caused by smoking. And depending on the pack years and the history of smoking, some of this damage is not reversible.
So Dr. Pelosa, after following the participants and measuring and tracking health outcomes for 3.5 years, what are the main findings?
Well, the findings is there's nothing to see. That we couldn't detect any change in any of the parameters, clinical parameters and radiological parameters and functional parameters that we were measuring. Not in a single individual. So let's forget about the average because it's a small study, but there was not a single participant who had any sign of early disease on any of these parameters.
So we're talking about lung and heart here as well.
We are mainly talking about lung because I think heart is going to take even longer to detect early changes. However, we just monitored vital signs, which is blood pressure and heart rate, because they are very easy to monitor and to measure.
Dr. Pelosa, in your paper, you outlined some caveats regarding the study, one being the sample size was rather small, 2, the length might not be long enough to capture early health changes, and 3, the vapors studied consumed only modest quantities of e-liquid daily. Do you think these caveats undermine the results and embolden anti-vaping critics?
This is the first study of its type, and we can derive some knowledge. It is not true that we cannot say anything about it. Of course, I might have had a study that was 7 years long, but I'm sure these people would have said that that length was not enough. When the data doesn't conform to your preformed ideology, it is never enough. I could have done it 10 years and it wouldn't be enough. However, if by chance I would have found even a single participant with a big lung problem or with some substantial lung damage in the high-resolution CT scan, I would have been famous. Yeah, because I would have highlighted some risk. And let me tell you, there is a percentage of people that are going to get risk from these products. And I can just give you a percentage. The percentage is going to be around 2 to 3%. It's the same percentage of risk and adverse events that you see in cosmetic industry when you use a cosmetic product. Just about the same.
Dr. Pelosa, one of the risks we hear about all the time from regulators and public health propagandists is that science shows nicotine can harm teens' developing brains. What do we really know about that?
Oh my God. There is very little evidence in human that nicotine can cause that kind of a problem. Most of the evidence comes from animal models, from rodents. And I listened to this frenzy of activity of adolescents and minors using vape products. I really question whether this is a problem of parents' accountability, because I don't really think somebody age 15 can just go in a shop and buy these products. I don't really think somebody age 15 can steal a credit card and buy these products on the internet.
Final question, Dr. Pelosa. Why is there such an imbalance in news coverage, skewing heavily towards scare stories on vaping?
I think it's very well known that bad news dominates the headlines. And e-cigarette stories are no exception. So that's simple as that. And I'm not very much surprised that in spite of the important implication for public health, even my study has had very little coverage by the media. And the irony is that is, as I said before, if our data were to show some negative findings, some lung damage, the news would have been all over the places. My work can be criticized and I'm ready to accept any criticism, but why shouldn't be another research scientist publishing very dubious data on rats, not accepting the same criticism and adding 10 times more my media exposure? I don't quite get that. It's unethical, it's inhumane, and it's immoral, because it's gonna cause damage to people.
Well, that's it for this edition of RegWatch. Before you head off, please like us on Facebook and don't forget to follow us on Twitter. For RegulatorWatch.com, I'm Brent Stafford.